slide, please. The conflict of interest statement. So Dr. Williams Kirkwood and her faculty preceptor, Dr. O'Brien, have no financial relationships with ineligible companies to disclose. Next slide, please. All right, now your turn.
Okay, thank you.
You're welcome.
Good afternoon, everyone. My name is Wynette Williams Kirkwood. I'm a psychology resident in the Integrated Primary Care Behavioral Health track, and today I'll be presenting on supporting children with sickle cell disease in primary care. By the end of this presentation, learners will be able to understand general information about sickle cell disease, including complications and treatments available for children, increase their knowledge about the relationships between sickle cell disease complications, academic achievement, and emotional outcomes, and finally, identify multidisciplinary approaches to assist children and families with sickle cell disease. So during this presentation, I'll be doing participant questions. Please use the chat box to answer the question. So the first question is, are you currently taking care of children with sickle cell disease in primary care or within your scope of practice? Sometimes. Okay. Can you clarify what IPS is? Adults, yes, not children, okay. Adults, okay. No, okay. Okay, good. So it sounds like well, it looks like there's a mixture of different responses. Some have not seen children with sickle cell disease in primary care. Others have worked with either adults or with children. Okay. And so my next question is, what barriers do you notice with children with sickle cell disease in your scope of practice? So please use the chat box. Helping families adjust to the diagnosis, okay. Stigma, bias, medical systems. Adherence challenges, okay. So it looks like there's a couple of barriers that a couple of you have noticed with children and families dealing with sickle cell disease. Okay. So the first couple of slides, I'm going to talk a little bit more about what sickle cell disease is. So sickle cell disease refers to an inherited red blood cell disorder that causes cells to become hard and sticky and form a C-shaped form. So as you can see in the graphic on the right, in part B, this is an example of like the sickle cell. So they stick to the blood vessel walls. And so the blockages causes poor blood flow. And so with the poor blood flow, it can lead to serious complications such as stroke and pain crisis, compared to part A, where you have red normal blood cells that are round and more flexible and able to move throughout the body. So in terms of brief statistics about sickle cell disease, about 100,000 people in the US are diagnosed with sickle cell disease. Sickle cell disease occurs in 1 out of 365 African-American births, as well as 1 out of 16,300 Hispanic Latin American births. Sickle cell disease is a public health concern. The projected life expectancy for sickle cell disease right now is 54 years old. In terms of primary care, only 20% of children experience effective care coordination between their primary care and specialist providers. And so this is related to more so limited access to care. So in terms of extended wait times, transportation difficulties, difficulties with reaching out to providers over the phone compared to other children without sickle cell disease in primary care. So in terms of sickle cell disease trait that differs between sickle cell disease, for sickle cell disease trait, pretty much a person inherits one sickle cell gene and one normal gene. And so they can be a potential carrier of it and do not experience any type of sickle cell disease symptoms, but they can pass this on to their children, as you can see in the bottom row. So 1 out of 4 children is likely to have sickle cell disease. And so sickle cell disease can actually be diagnosed through a blood test or through newborn screenings or prenatal screenings as well. So in terms of treatment options, there are several options available for sickle cell disease diagnosis. The first one is hydroxyurea, which is for ages 2 and up. Typically, this helps with lowering pain crisis or pain episodes. Then the second one is crizanlizumab, which is for adults and children ages 16 and above. And then you have Alexator for ages 4 and up, as well as glutamine for ages 5 and up, and blood transfusions. Typically with the blood transfusions, these are done on an ongoing basis, and it helps with reducing the risk of stroke. For the blood and bone marrow transplants, this right now is like the only cure for sickle cell disease, and it's very difficult to get the blood and bone marrow transplant because typically children have to have a perfect match, and there's few within the United States that have the blood and bone marrow transplant that have actually went through the process. So in terms of sickle cell disease symptoms, most newborns may experience symptoms as early as 5 to 6 months old. Typically, this is in the form of jaundice or in the form of anemia, as well as dactylitis. Dactylitis refers to the swelling of hands and feet. There are numerous sickle cell disease complications, as you can see here. So you see pain in the form of vaso-occlusive episodes, as well as stroke, which can be silent infarcts, as well as overt stroke. You also have acute chest syndrome, so difficulty with breathing. There's anemia, a vascular necrosis, dactylitis, as I mentioned before, blood clots, kidney and or liver problems, as well as organ damage, priapism, pulmonary hypertension, sleep disordered breathing, splenic sequestration, as well as vision loss. And so the reason why I have the 3 bolded, as you can see here, is that typically these are most common, or what you may see with children diagnosed with sickle cell, in addition to the complications that I've mentioned here. So based on the review of the literature, besides the different sickle cell disease complications, there's also psychological factors that impact children with sickle cell disease, and one of them is academic achievement. So based on the review of the literature, it's been found that chronic anemia, systemic ischemia, as well as silent cerebral infarct. So this is basically there's no physical evidence that they're having a stroke, but you can see it from like their MRI scan, as well as overt stroke. So this is, a stroke that is actually occurring. All these different factors can impact cognitive development. And so this is really important when we're thinking about children with sickle cell disease, because cognitive deficits often occur in the frontal lobe, where many abilities such as working memory, attention are strongly related to academic and behavioral problems among children with sickle cell disease. And so with these cognitive concerns, as well as sickle cell disease complications such as the strokes, IQ, verbal reasoning, perceptual reasoning, as well as executive functioning can decrease over preschool age to school age children. This was actually found in a meta-analysis. So in terms of emotional factors, sickle cell disease is also related to that. So based on the review of the literature, it's been found that children tend to experience more internalizing and externalizing problems as it relates to a lower full-scale IQ based on a meta-analysis. There's other additional emotional factors that can be related to severe chronic pain. So for example, depression, anxiety, coping, stress, pain catastrophizing, other psychological factors can be related to pain. It's also been found in the literature that patients with sickle cell disease and depression tend to have more hospitalizations than those that do not have depression. And anxiety in children with sickle cell disease may be related to unpredictability or anticipation of pain episodes. So pain episodes can be very sudden and unpredictable. Sometimes the anxiety can be triggered by the pain not being adequately treated or their interactions with the healthcare system. And I think someone mentioned about that potential bias or stigma, and that also plays a role with anxiety. So when we think about the biological factors, the psychological factors, there's an importance for multidisciplinary care. So as you can see here in the graphic, this was actually created by the American Society of Hematology. And so pretty much what this graphic is telling is that multidisciplinary care is needed to provide optimal treatment for sickle cell disease management. So teams should include not only the PCP, the primary care provider, but it should also include the hematologist, nursing, pain medicine, the psychologist, physical rehabilitation, social work, and other integrative health approaches. So pretty much like an all systems approach. Everyone is involved in the treatment of the child and the family. And so with this, appropriate education about the illness, ongoing communication across all providers on the team, as well as adequate coping mechanisms can maybe potentially helping with the quality of life for children living with sickle cell disease. So with that being said, I'm curious to know, how do you integrate multidisciplinary care into your practice when managing children with sickle cell disease? And you can answer in the chat box. Using BHC, okay. Bring in behavioral medicine team members, okay. Social work if needed, pharmacy, okay. So it looks like you're using different team members on your team to improve the quality of care for children living with sickle cell disease, okay. Anybody else has anything to share for this question? Collaborating with the medical team and specialists that can care for the patient within our system. Good, good, good. So it looks like you're already using multidisciplinary team care when working with patients and families. That's good. That's good. So, based on what I've discussed with the multidisciplinary care, there have been several guidelines that have been published. For example, the American Society of Hematology actually created clinical practice guidelines on sickle cell disease. And their reason was because for children living with sickle cell disease, it's often the responsibility of primary care, family, and other emergency medicine physicians. And so based on the literature, it's been found that 80% of family physicians report feeling uncomfortable treating people with sickle cell disease. 73% of family physicians believe that more education and support tools would help avoid complications in managing sickle cell disease. And then finally, 69% of family physicians report that clinical decision support tools will be helpful for treating sickle cell disease. And so based on these guidelines, it's helpful to provide evidence-based recommendations for emergency physicians, primary care physicians, family physicians, hematologists, and patients to learn more about how to manage sickle cell disease. And so these guidelines are important because the American Society of Hematology, they actually appointed more than 70 individuals from different specialties that I mentioned in the previous slide to review evidence and formulate recommendations to address adult and pediatric sickle cell disease in 2016. And so the goal is to provide best practices for improving their quality of care management for both acute and chronic complications. And so you can find more of this information online, but this I feel like will be helpful to include in your scope of practice when working with patients and families within a multidisciplinary care team. There's other additional guidelines available. So for example, the National Heart, Lung, Blood Institute formulated evidence-based management of sickle cell disease from their expert panel in 2014. These guidelines were developed by healthcare professionals with expertise in family medicine, adult and pediatric hematology, as well as psychiatry, emergency department medicine, evidence-based medicine, other disciplines. And so it's similar to the American Society of Hematology in terms of the multidisciplinary team. And so it's used to address the care for infants and children as well as adults. And so if you're interested, I encourage you to peruse this information, review this information further. So there are other additional guidelines as well. So the American College of Emergency Physicians also have guidelines on how to manage sickle cell disease in the emergency department. There's also more information from the American Journal of Nursing about how to manage complications of sickle cell disease as well from the nursing perspective. So based on the information that I've covered thus far, for medical providers, it's really important to consider these clinical guidelines from national organizations such as the American Society of Hematology, as well as the National Heart, Lung, and Blood Institute. Again, with multidisciplinary care, it's really important to integrate the involvement with caregivers, children, and other staff. Continue to provide families with education about sickle cell disease. Sometimes families, based on my experience, may not have a lot of knowledge about sickle cell disease. And so it's really important to include or encourage that conversation, as well as keep continuing the ongoing conversation about medication adherence. When needed, a behavioral health support may be helpful to address these emotional or behavioral concerns. So for example, psychological adjustment or testing. So with warm handoffs, pretty much the provider can help introduce the psychologist or the behavioral health consultant to the child and to the family. And then after that, the psychologist and behavioral health consultant can conduct the visit. If the child and family are not available, then meet and greets may be helpful where they can simply introduce themselves, say, hey, I'm Dr. So-and-so, this is my role on the team. And that can be also helpful to, kind of coordinate efforts to support the family with emotional and behavioral needs. So for behavioral health consultants and our psychologists, again, it's really important, especially when we're thinking about team-based care, team-based medicine, to continue ongoing communication with medical providers, patients, and caregivers. It's important to familiarize themselves with resources available within the community. For example, the Sickle Cell Association of Texas, being able to coordinate with parents to develop pain management plans. So for example, it might be helpful to talk to parents about, what are some potential warning signs? How do they know that their child, is experiencing severe pain? Maybe working towards doing some relaxation skills first before they go to the emergency doctor, giving them, emergency contact information, being able to talk to the provider about, different pain medicine that may be available. All those different things can be included in the pain management plan. And so I also think that it's important for not just the psychologist, but also the provider, the medical provider, to be involved in the process as well. And it should be, again, an ongoing team-based approach. For psychologists or behavioral health consultants, it may also be helpful to explain about the 504 or the IEP process. So for example, for 504, it's more so broader based, so it relates to more so like cognitive deficits or school accommodation. So for example, being able to talk to parents about, if a 504 plan is in place, maybe a child can get a second set of textbooks at home. Perhaps there can be preferential sitting in class. Perhaps, the teacher can give them a study guide to learn on their own. IEP services can also be helpful to create specialized learning. And so it's really important to encourage parents, especially if they have an IEP plan, to continue to meet with the committee to discuss, their child's strengths and weaknesses. Maybe they can talk more about tutoring, PT, so physical therapy, speech therapy, extra time during tests, those different things of that nature, to coordinate those services for the child while they're in school. And then also for psychologists, it's also helpful to provide behavioral health approaches for addressing the adjustments to sickle cell disease, managing emotional outcomes, and other concerns as well. So based on the review of the literature, it's been found that cognitive behavioral therapy is commonly researched. There has been a review article from Williams and Tanab in 2015. They conducted non-pharmacological approaches to managing sickle cell disease. And what they found was that CBT reduced pain in several of their studies. And so it's also been found in the NHLBI guidelines, as well as the American Society of Hematology guidelines, that CBT can be helpful for patients and families with managing sickle cell disease. And so other treatment-based approaches could also be helpful too for children and families. So for example, you have acceptance and commitment therapy, which I'll talk about further. Mindfulness-based stress reduction, biofeedback have also shown promising results with pain, although it has not been tested in the sickle cell disease population. And I also want to mention that with CBT, currently right now, there is no current manualized treatment for sickle cell disease for children that are living with sickle cell disease in primary care. But CBT can be transdiagnostic and adaptable for these particular patients with managing their pain. So in terms of CBT, known as cognitive behavioral therapy, these are just different examples of interventions. This is not, a laundry list, but for cognitive restructuring, it can be helpful for clinicians to work with patients and families to identify negative thoughts. So for example, to help the child determine how useful or how valid this thought is by evidence, and creating a more neutral way of thinking. So for example, the child may say, there's nothing I can do to stop the pain. Through cognitive restructuring, another way of looking at it could be, I've had good and bad days, but pain won't stop me. That could be an example of cognitive restructuring that clinicians, psychologists, behavioral health consultants can use. Another approach is activity pacing. This is about engaging the child in appropriate physical activity without having them experience significant pain. So for example, the clinician might encourage the child to do activities such as walking, trying to do that for as long as they can before the pain episode happens, and being able to encourage them to have a rest time. And typically with activity pacing, sometimes clinicians may encourage that child and family to rate their pain on a scale. So 0 equals no pain at all, to 10 being painful. And so really the goal of activity pacing is to build the child's endurance, as well as to improve their functioning as well. And then you also have relaxation skills, so diaphragmatic breathing. This can be in the form of square breathing, so encouraging the child to breathe in for 4 seconds, hold for 4 seconds, breathe out. You also have progressive muscle relaxation. So you're encouraging the child to tense different muscles in their body. So it could be their shoulders, it could be their legs, their feet, their calf muscles, for example. And so really the goal is to help with managing the pain. It may not be the only resource. It could also be other medications involved. But again, it's really important to have that multidisciplinary approach when considering this particular intervention. And then you also have visualization and guided imagery. So for example, clinicians, behavioral health consultants, psychologists can encourage the child and family to think about a peaceful place besides their room. So then that way it can help the child immerse themselves into the experience. And so sometimes children that I've interacted with have talked about, being at their grandparents' house or, being on the beach. And so sometimes when we go through the visualization or the guided imagery, they may talk about, the smell of cookies. This helps me to feel a little bit better. So these different types of relaxation skills may be helpful when we think about managing sickle cell disease pain. You also have acceptance and commitment therapy. So the first one is shifting the perspective from pain reduction to value living. So shifting the perspective is very important because sometimes families may come in and say, nothing works. And so for clinicians, it may be helpful to ask them, what worked versus what didn't work, what have you tried? Encouraging the child to think about, what would life look like without pain? Maybe this can be done through like a drawing activity to give that child perspective about it. And I also want to mention that clinicians, especially if they're using acceptance and commitment therapy, it might be helpful to do this more so with preteens or adolescents, depending on their developmental level. And so once you do the shifting perspectives to value living, that's when you can connect to like their values. So for example, a child may say like, in order to live a pain-free life, I want to be able to play basketball more, or I want to be able to draw more. You can do this through the values clarification technique, and then setting tangible goals or a commitment to action to that. So this can be in the form of a SMART goal where you're encouraging the child or family to, play basketball, maybe for about 10 to 15 minutes, depending on their pain level. But really the overall goal is to get them involved in different things that they value doing. So in terms of pain screeners, these are just examples of different types of pain screeners available. Again, this is not a laundry list, but the first one is the numeric rating scale. Typically, you can say this out loud, on a scale of 0 to 10, 0 being no pain at all, 10 being worst pain, how's your pain today? So you can administer this to children ages 8 and older. There's also the Wong-Baker's FACES scale. So pretty much the faces are on a sheet of paper or on a flyer, and then it has like those pain ratings underneath. And so this may be helpful for like the younger kiddos when thinking about sickle cell. And then you also have the visual analog scale as well, where the child may mark, on the scale of 0 to 10, how their pain is. And so for unidimensional, the reason why I have asterisks here is that it's available online. And I also want to mention too with the unidimensional pain screeners, that it may be helpful to do this when you're introducing an intervention such as a relaxation skill. So like the diaphragmatic breathing, the progressive muscle relaxation, the visualization or guiding imagery. So you can do this before the intervention and then after the intervention to see like, if there's been any type of differences in pain. There's also the NIH, so the National Institutes of Health Promise Measure. This is given to children of all ages, and there's also a caregiver and parent proxy report. This is also available online. You have to register. But they ask questions about like pain interference, pain intensity, PEDS QL, sickle cell disease module is available for ages 2 through 18. So some questions from PEDS QL is, in the past month, is it hard to do things in pain, or I miss school when I am in pain? And so it's like a Likert scale system. You also have the adolescent pediatric pain tool for ages 8 and above. And so those questions include pain intensity, location. They also have a list of descriptors as well for children to point out words that best describe their pain in the moment too. So in terms of helpful resources for clinicians, it may be helpful to utilize the Society of Pediatric Psychology. If you're a member, they have the resource bank for you to access the information. They also have special interest groups such as hematology oncology, as well as pain. There's also the Foundation for Sickle Cell Disease Research and Education Symposium. Typically, this is held in June. And then there's the Sickle Cell Disease Association of America. On their website, they have a host of various chapters across the country. Texas has one here. They also have advocacy groups, community health information as well. And then on a community level, you have sickle cell resources from the Texas Department of Health Services. So they include information about the clinical guidelines that I've mentioned, of the different community organizations throughout the state, as well, and other pertinent information. And then the last bullet talks about the Sickle Cell Association of Texas, Mark Thomas Foundation. So currently in the state of Texas, there's chapters in Austin, Houston, and San Antonio. So there's Camp Celebration. Typically, this is geared towards ages 6 through 14. as well as Camp Next Level, ages 15 through 19, and then Escape Retreat. And so pretty much through these camps, children, young adults, they can learn more about what sickle cell disease is. I think for one of them, there's a college preparation class as well. And so it's very, community oriented. Children can connect with other children living with sickle cell disease as well. So for parents and caregivers, it's really important to talk to primary care providers about their children's growth and development, to share the history about their children's sickle cell disease diagnosis, encourage their child to attend hematology appointments, even if the child is well, being able to encourage the child to drink enough fluids and maintain a healthy diet. So for example, 8 to 10 glasses of water. And so drinking enough water is really important when we think about the context of managing pain, healthy diet as well. Creating a plan for getting your child to the emergency room. So I mentioned it earlier, but encouraging the parents to know, sort of the warning signs, how do they know that their child's in severe pain, knowing about the different pain medications that are available, having information or a list of different emergency providers or hospitals that they can go to. This is really important. For the family to have something in place. And so again, like I mentioned earlier before, that it's really important for psychologists, behavioral health consultants, primary care providers, everybody on the team to collaborate when we're thinking about the emergency plan as well. For this last bullet, it talks about staying connected with teachers about plans in case the child misses school. So oftentimes with sickle cell disease, pain is very unpredictable. It's kind of complex. And so sometimes children can miss several days out of school. So it's really important for parents and caregivers to talk to teachers about, how their child can make up the assignment, if there's any type of tutoring support available, and other different options, just in case their child misses school. And so this first bullet talks more about just encouraging an open and honest communication about the disease, school performance, and other emotional concerns with child. So social support is really important when we think about parents and caregivers. And, it's really important to encourage that communication. The second bullet talks more about like therapy interventions. So it might be helpful for parents and caregivers to emphasize the importance of, using relaxation skills, using cognitive restructuring, using these different interventions to help their child with managing pain. The last bullet also talks about developing a checklist for visiting health providers, school personnel, as well as others. For clinicians, they may want to encourage parents to formulate a list of questions that they may have for doctors or for school personnel, and for others about their child. So for example, what medication should I use? If my child's experiencing crisis, how do I know, when to go to the emergency room? These different types of questions may be helpful for talking to health providers. And then for school personnel, again, having a list, especially during like IEP meetings or general discussions with teachers about, what should happen if their child misses an assignment. So all of these different bullets are, encouraged for parents and caregivers. So in terms of helpful resources for parents, these are just examples of several options available. So the first one is the Sickle Cell Disease Coalition community resources. So on their website, they have tips about sickle cell disease that every emergency provider needs to know. There's also fact sheets for athletes and coaches as it relates to sickle cell disease diagnosis. There's basic sickle cell disease information and other pertinent information available on the website. You also have the Caregiver Help Desk, which is through the Caregiver Action Network. This might be helpful for clinicians to give to parents if they have any questions about how to support their child. The phone number is available here, but they can contact them by phone, email, or live chat on Monday through Friday at 8 a.m. to 7 p.m. Eastern Standard Time. You also have the roadmap for sickle cell disease caregivers, which includes toolkits, clinical guidelines, the transition from child to adult care. There's also information about approaching racism in primary care, as well as financial and legal resources and other information. And so this is actually an example of the roadmap of resources for sickle cell disease caregivers, as you can see here. So the first part, again, talks about like the basic information about what is sickle cell disease. The second part talks more about like caring for sickle cell disease complications. So for example, blood clots, lung health, kidney health, stroke prevention. There's also the guidelines that I mentioned here that can help educate care teams. So they have the American Society of Hematology clinical guidelines. There's also the National Heart, Lung, and Blood Institute clinical guidelines, as well as Project ECHO, CDC tips for emergency providers, and then the treatment facts sheet. And then on the other side, they have information about like assisting families with transitioning from pediatric to adult care. You also have information about resources to assist within the hospital setting. So how to approach racism in healthcare, how to be an advocate for yourself, what to know before going to the ER, patient file checklists, as well as medication checklists. And then these are emotional health and well-being resources. So wellness fundamentals, mental health tests, 10 tips for family caregivers. And then there's also some information at the bottom about financial and legal resources as well. So in terms of books for patients and families living with sickle cell disease, I chose these books listed here, but there's so many different books available online for patients and caregivers if they're interested in learning more about sickle cell disease. The first one may be helpful for children between the ages of 2 to 7 years old. This relates to All About Sickle Cell by Nayoka McCoy. So it includes pictures about sickle cell disease. The second one is for ages 8 through 12 years old. This is actually a book series called My Friend Jen, A Little Different, and it talks about this girl's journey living with sickle cell disease. And then you also have Hope and Destiny Jr. For ages 13 through 18. And so this was written by Sylvia R. Brandelis, as well as Louis L. Hisu and Carmen Rodriguez. And so this includes pictures, games to learn more about sickle cell disease. They also answer questions from the child's perspective, and it's also available in brochure format and can be used in primary care as well. So thank you. This concludes my presentation. Are there any comments or questions? This is very helpful information. Thank you. You're welcome, Ms. Bradley. I'm glad that it was helpful for you. Excellent presentation. Thank you. Thank you. Thank you so much, everyone. Any guidance on addressing treatment non-adherence with patients and families? That's a great question, Dr. Obai. I think in part with addressing treatment non-adherence, it might be helpful to, again, help families with thinking about the pros and cons of taking medicine, right? Also thinking about their values. So for children living with sickle cell disease, you know, they're also dealing with school issues, they're dealing with peer influences. And so depending on what the treatment adherence may be tied to, it may be helpful to tailor that particular approach for managing treatment adherence concerns.
Do you have any recommendations for kids who are kind of aging and taking over their own care from their parents?
That's a good question. So there's actually some resources available from the roadmap for caregivers. I can share here. So let's see here. So they have some resources here, like the St. Jude's STEP program for teens living with sickle cell disease. And then there's also some transition materials for providers. There's a website called Got Transition, and there's a checklist that may be helpful to prepare children, well, to prepare adolescents to the adulthood care practice. And they also have like a toolkit available for families as well. So I encourage you to utilize this resource as well as Got Transition to utilize that with families who may be dealing with transitioning to adult care.
Thank you.
You're welcome. Any other questions? I guess my question for you all, okay, well, let me see. That's becoming violent wider, thinking about, made me think of allowing fluids throughout the day. Yes, so Alex, that's a great point about allowing fluids throughout the day. So like I mentioned before, it may be helpful for clinicians, psychologists, behavioral health consultants to collaborate with families to include this into like their plan, you know, allowing the child to have breaks throughout the day to drink water. So again, you know, water is very important when we think about sickle cell disease management because it helps with reducing pain. But there's also other factors that can help with reducing pain as well. So sickle cell disease, yes, it is hereditary. So you can get this from a carrier of the trait. So my question for you all is how, based on the presentation, how might you adapt your approach working with children and families with sickle cell disease? So what's one thing that you may use from this presentation in your scope of care? You can put that in the chat box. One, two, three resources. Okay, Bridget. Providing them with the educational resources you provided us. I took photos of some of your slides so I can pass your suggestions in my future practice. Thank you. Yeah, so I agree, Dr. Justin, as far as that. I feel like the camps will be helpful for letting families and children know about different resources available to connect with other children that are dealing with sickle cell disease. Okay, so in conclusion, sickle cell disease complications can greatly impact a child's quality of life. There are various biopsychological factors that impacts children's management of pain, such as adjustment to school, as well as pain outcomes, so depression, anxiety, pain catastrophizing. And so based on these biological factors, these psychological factors, multidisciplinary approaches to sickle cell disease management may be helpful to reduce disease severity among children living with sickle cell disease. And so this concludes my presentation. Here are my references. And thank you for joining. And please remember to complete and submit your session evaluation.
All right, thank you everyone for joining us, and thank you for this presentation. It was really good. And we'll see everyone next week, okay?
Thank you.